Hello, my name is Dr. Bruce Garber. I'm a urologist and my practice is in the Philadelphia area. I specialize in the diagnosis and treatment of male impotence or male erectile dysfunction, and in particular I specialize in penile implant surgery. I want to give you today a little presentation about male erectile dysfunction and the causes and the diagnosis and the treatment options. And in particular, we're going to stress the option of a penile implant. Not that many people know much about the implant option, but it is an option that I specialize in and have focused on for roughly 25 years. It is a surgical subspecialty. I can tell you there are only really a handful of doctors in the United States that do a lot of this work and have done personally over 2,000 or 2,500 cases over a period of years. In any event, let's talk about male erectile difficulties. It's an extremely common problem. We estimate that perhaps 30 million men in the United States have erectile difficulties. Not only is it a common problem, but it is very undertreated. Many men don't know that there's effective treatment available, or some just try oral medication, and then if that doesn't work, they just give it up. They don't know that there are further treatments that are helpful. The thing I want you to remember is this: we can help virtually every single man that has an erectile difficulty one way or another, either with our first line, second line, or third line treatments. Now, how do normal erections work? It's important to know how they normally work so that you can understand what happens when they don't work and how we might go about fixing that. Normal erections are just a hydraulic process. Okay, blood has to go rushing into the erection chambers in the penis, and then the valve system has to shut off to keep the blood in your penis. And then when the erection is not needed, the valve system has to open up and the blood goes back into your body. However, the erectile mechanism is delicate and it will frequently malfunction. For example, men who have high blood pressure, who have diabetes, who have had prostate cancer, who have had prostate surgery, prostate radiation, other pelvic surgery. There's a whole host of things that can interfere with the normal erectile mechanism and lead to erectile difficulties. Now, once a man has this, there are a number of treatment options to consider, and I'll just briefly review those with you also. Our first line of treatment are the oral medications, the pills. And the pills go by the name of Viagra, Levitra, and Cialis. These medicines have been around for a number of years now, and they have been a tremendous help to many, many men. Many millions of men around the globe are taking these pills and have been able to successfully resume their sex life. Overall, they have a very excellent safety record. However, there's a couple things you must keep in mind with regard to those medicines. Number one, the pills only work for about 60 or 70% of guys. So as you can imagine, that leaves a very large number of guys who try the pills and do not find that they're satisfactory. For example, some guys find that the pills do not provide a rigid erection. Other guys take them and they get side effects. Other guys do not like the fact that you have to time your sexual activity shortly after you take a pill. Other guys cannot afford them because sometimes the insurance plans will not pay for them. So when the pills don't work, we have other treatments that are available. For example, our second line treatments include things such as the vacuum pump, the injection, and the intraurethral medications. There's one called Muse. Those second line treatments are successful in a fair number of men, but similar to the first line treatments, not all men find them satisfactory. Some men find that, for example, the injection program is uncomfortable. Sometimes it's inconsistent. Sometimes it can be expensive and unreliable. Some guys use injection therapy and they get scar tissue in their penis. So for some men, the second line treatments do not work, or they get tired of them, or they just cannot afford them and want something more permanent. For those men, we have what we call the implant option. And I wanted to go over the option of a penile implant today in some detail. This is an area that is a subspecialty. It's a urologic subspecialty. It happens to be my subspecialty. Over the years, we've done many thousands of guys who have not responded to simpler therapies, and we have successfully helped them with a penile implant. So I wanted to explain what an implant is and how it works and what it can do for you. As I mentioned before, implants are like a new hydraulic system for your penis. When your own hydraulic system is not working, we can now install a new hydraulic system. Implants come in a number of different configurations, but by far the best and most realistic option is the fully inflatable model. And they work by virtue of inflatable cylinders that we place inside your erection chambers, and there's also a pump that we place in your scrotal sac in between your testicles that allows you to operate the device. The procedure is usually done as an outpatient, and it's nothing new. These implants have been around for over 30 years. Something that many men don't know is that implants are often covered by insurance. They are not cosmetic. They are not designed to improve the way you look or your appearance. They are designed to improve a lost function. So they're not that much different than hip implants, knee implants, intraocular lenses, and other implantables of that nature. They're designed to correct a lost function. We filmed a couple of implant procedures, and we've edited it down so that you can see just in the space of 8 or 10 minutes how an implant procedure is done. We do almost all of these outpatient now, and that means you come to the hospital, you get your procedure done, you have anesthesia during it so you feel nothing, and then you go home the same day. Most guys do take a few days off from work until they're feeling better, and then they can gradually return to their normal activities. Typically you have to let the implant heal up about 6 weeks before you can start to use it. Once enough healing has gone by, you would return to the office, and then we instruct you on how to operate the device. Once the implant is healed, you are able to resume your sex life. Implants have a large number of advantages, and many men are not aware of these advantages. Some of the advantages are as follows. Number one, an implant is a permanent solution. Okay, if you're taking pills or shots, they are not permanent solutions. You have to use them each and every time that you want to have sex. Once you get an implant, the problem is basically solved. The implant is always with you, it's always ready. You can use your implant as often as you like. There is no restriction to it. If you're on vacation and you want to use it 3 times a day, you can do so. It allows you to get an erection virtually in a few seconds. Okay, so you can get an erection on command. You can control the rigidity or the hardness of the erection. You can use your implant as often as you like. You can maintain the erection as long as you like. The implants are put in such a way that they do not interfere at all with any of the pleasure, the sensation, climax, ejaculation, or orgasm. When you have an implant, your erection will not go down after you reach a climax, so that you can maintain it literally as often as you like and for as long as you like. They are designed so that they're completely internal. There's nothing outside your body. They are designed so that if you do not tell your partner is not going to know that you have an implant. They're designed to be undetectable by most women. The only thing that the ladies will know is that for some reason you can maintain an erection better than any other guy they know. And that brings up another topic unique to implants. When you have an implant, not only will it restore your erection, but it will restore your confidence. Okay, and what I mean by that is this. When you're taking a pill or a shot, you're never quite sure if it's going to work, how long the erection will last, how hard it will be, and how successful you will be. When you have an implant, that uncertainty is gone. You know that you can get an erection whenever you want. You know that it can be as hard as you like. You know that you can maintain it as often and for as long as you like. So not only does the implant give you an excellent erection, but it can restore your confidence in terms of your sex life. And that confidence is a huge issue and a huge benefit of the implant procedure. I may have mentioned that many insurance companies cover it. They are, of course, FDA approved. They have been improved continually over many, many years. And the implants that we have available now are among the most reliable of all implantable devices. In the videotape you're watching, I'm doing what we call the Coloplast Titan, fully inflatable penile implant. And as I mentioned before, that's the optimal configuration, the fully inflatable model. It gives you the best possible erection and the best possible flaccid state. If you want to know a little bit more about this topic, I do have a website. You can visit my website and learn a little bit more about it. On the website I have some publications, I have some photos of guys who have implants, I have a further photography of it. I also have a number of articles, publications that I've written, and it reviews all the ins and outs of implant surgery. My website is www.garber-online.com, or if you want to find out more information on a more personal level, you can call us at 215-247-3082. In any event, I hope you find the video informative and helpful to you in your decision-making process.